Hi, and welcome to EFFORT Clinical Trial Training. I'm Sophie, the Clinical Trial Monitor for EFFORT from Menzies School of Health Research in Darwin, Australia. This video series will go over study conduct and procedures so you can start the trial with confidence. I would advise that you read over the protocol before you start these videos. The protocol dictates the study procedures, follow-up, and lab processing in further detail. The EFFORT trial in Cambodia will be run in partnership between Menzies, Moru, and CNM. Menzies is the sponsor, which means we take responsibility for the initiation, conduct, management, and some of the financing of the clinical trial. Let us go over a quick background and rationale. If you are interested in the full scientific write-up of the background and evidence, please refer to the protocol. A background to the importance of the P. vivax malaria research is that P. vivax is associated with significant morbidity, and policymakers recognize the importance of its control and ultimate elimination. Radical cure of P. vivax malaria involves blood stage treatment and also a liver stage treatment in primaquine or tafenoquine. So while these drugs are effective, a risk is that primaquine and tafenoquine can induce hemolysis in G6PD deficient individuals, which has required point-of-care testing prior to the administration of medication to ensure safety, and it is only in recent years that that point-of-care test has become available. In addition to the quantitative point-of-care G6PD test, there have been other major advances in the tools to tackle P. vivax malaria. Single-dose tafenoquine has been licensed for use in the USA and Australia, and a large randomized controlled trial called IMPROV showed that short-course high-dose primaquine was as safe and effective as 14-day primaquine. So we designed the EFFORT trial to compare these novel treatments and assess safety, effectiveness, cost, and feasibility of using such treatments in your region. The novel treatments will be compared against a control group of 14-day low-dose primaquine. The objectives of the trial is to look at the incidence risk or time to first event of symptomatic P. vivax parasitemia during the 6-month follow-up between the PQ7 arm and the control arm. The secondary outcomes is the incidence risk of symptomatic vivax parasitemia during the 6-month follow-up between the PQ7 and the TQ arm and the TQ and the control arm. We'll also look at the incidence risk of severe anemia, a hemoglobin of less than 7 grams per deciliter, and or requiring blood transfusion within the 6 months follow-up treatment. So before the study enrollment starts, a pre-survey study to find the G6PD normal cutoff must be completed. This is a short survey involving a total of 30 healthy volunteers. The criteria for inclusion are male adults who are negative for malaria, with no fever and no surgery in the last 6 weeks, no blood transfusions in the last 6 weeks, and they must provide a separate consent. After the consent is completed, we'll take 1 fingerprint sample of 10 microliters to measure G6PD activity with the SD biosensor. There's no more follow-up required after they've given this small sample. So after this, we will enter the data into a log, and the Excel file will calculate the adjusted male median of G6PD activity in your area. And this will be the cutoff for inclusion into the trial. There are 3 treatment arms in the study. In every treatment arm, all participants will receive shizonticidal treatment. This medication is called Piramax, and the dosing will be according to body weight. You will be provided treatment tables so that you can calculate the correct dosage. Piramax is taken orally with water, once daily for 3 days. Common side effects include headache, vomiting, and abdominal pain. Piramax is contraindicated in individuals with severe liver disease. There are 2 primaquine treatment arms. The control arm is 14 days low dose, total dose of 3.5 milligrams per kilo primaquine. The first intervention arm is 7-day high dose primaquine, a total dose of 7 milligrams per kilo. Treatment will start on the day of enrolment and the first dose given under supervision. Participants will then receive the remaining tablets to be taken at home, with instructions on how to complete their treatment and when to come back if they have any worrying side effects. We ask that participants stay in the clinic for at least 30 minutes, and if they vomit the first dose, a repeat dose can be administered. The dosage will be according to body weight, and we will provide treatment tables for you to calculate the appropriate dose. A reminder that primaquine is taken orally with water, and it must be taken with food to avoid gastrointestinal upset. The second intervention arm is tafenoquine. 300 milligrams of tafenoquine will be given as a single dose to participants who are randomized into this second intervention arm. Like primaquine, tafenoquine is taken orally with a drink of water and given with food. Some common or possible side effects of tafenoquine is headache, diarrhea, dizziness, or back pain. And rare is hemolytic anemia, which is why we test for the G6PD activity before the participants enter the trial. We'll now go over criteria for enrolment in the EFFORT trial. Inclusion criteria must be met. This is P. vivax monoinfection as determined by microscopy, G6PD normal status, a fever or a history of fever, age of more than 18 years, written informed consent, and living in the study area and willing to be followed for 6 months. In addition to the inclusion criteria, you must check for the following exclusion criteria. General danger, signs or symptoms of severe malaria. Using your clinical expertise, this could include impaired consciousness, generalized weakness, deep breathing, respiratory distress, low systolic blood pressure of less than 80 in adults, clinical jaundice, hypoglycemia, anuria, or hemoglobinuria, or a history of blood in the urine. We also want to check the hemoglobin for anemia, which means the participant will be excluded. This is defined as a hemoglobin of less than 8 grams per deciliter. We are not including any pregnant women, and every woman should take a pregnancy test when assessing the criteria for inclusion and exclusion. Again, breastfeeding women, and any known hypersensitivity or allergies to the drugs that will be given in the trial, and regular use of drugs with hemolytic potential, and the history of blood transfusion in the last 4 months. After screening for inclusion and exclusion criteria, you'll know if the participant is eligible or not. If they fulfill all inclusion and do not fulfill any exclusion criteria, you can take written informed consent from the participant. And then they need to be randomized into either the control or an intervention arm. The randomization envelopes are in order and will be provided to you by Menzies. So please only open one at a time and take from the next envelope in line, as these have been prepared by a statistician. In this section, we will discuss briefly the forms and logs that are required prior to the commencement of the trial. The delegation log is the log for staff to ensure that staff working on the trial are qualified and experienced, and you will be required to submit your CV for the file. You'll be delegated by the site PI, and you will need to sign the signature and responsibility log. This ensures the safety of the participants and the integrity of the data. The screening log is one of the required documents to also maintain the data integrity of the trial. The screening log that is current for Cambodia is on the screen now. As you can see, you fill in subject screening number, which is just numerical, date of screening, microscopy results, age, weight, all the inclusion-exclusion criteria here. And then if the participant is enrolled, there is yes or no, and then their subject number, which will come on the randomization envelope here. Here we have an example from another clinical trial that we completed. I just wanted to point out that you cannot use quotation marks to indicate that it is the same date. You must use and write the full date or the full entry in that box. The subject ID log is the only log in the trial that will contain the patient's names and will link the patient with his or her subject number. So this log is kept in the investigator site file in a locked and secure area and must not be moved off the site. The sample storage log is to keep track of all the very important samples that will be collected over the course of the trial, and this ensures that when the samples are then shipped to the relevant reference laboratory, that there is an excellent tracking system in place. And when taking informed consent, we have the informed consent in Khmer language on the left, and the informed consent form is also available in English. When obtaining informed consent, adequate information must be provided, and you should ensure that participants have comprehended the information and prompt them to ask any questions they have about the trial. Also make sure that participants are aware that if they decline to enter the trial, that this will not prevent them from receiving a normal standard of medical care. The participants must personally sign and date the informed consent form, and they must be provided with a copy to take home of the participant information sheet and the consent form. That concludes the first video in the training series for effort. Just a reminder before you go that please practice within good clinical practice guidelines. Patient safety is the priority. Hemolysis is a risk in participants taking primaquine and tafenoquine. So you must be aware of the warning signs of a hemolytic serious adverse event. And this is all covered in the safety video, which follows after this in the video collection. Thanks again.